panel discussion that I moderated yesterday was by members of the Mobile Health Regulatory Coalition, or mHealth Regulatory Coalition, which we often call MRC. And really what we wanted to talk about was our philosophy and our approach that we've shared very openly with the public, with FDA. We've been very transparent, and it's a very broad group of participants that include some of the major sponsors here like Qualcomm, like Verizon, Wireless, like AT&T, and we have a lot of medical device companies. We have WellDoc, MedApp, so a lot of the folks that are on the floor, the leaders, the visionaries in this space recognize that regulation is going to happen, and there's three options. There could be over-regulation and kind of let it sort of take its course without having some industry dialogue with the agency. It could go the other way perhaps, but that's unlikely, that there's going to be very little regulation. And then there's probably an appropriate level of regulation that balances the need to protect patient safety and make sure that these devices are effective and to do what they are intended to do. That's really the mission of the FDA, along with fostering innovation. So we felt like we needed to collaborate and work with them in the right framework and have a broad range of participants come to the table and talk about that very candidly and share with them some of our questions and concerns and recommendations. Regulation of medical device hinges on three primary areas of concern to the mHealth community. That starts with intended use, because that's really what determines whether or not your technology is actually considered a medical device by the law, and then if FDA regulates that. So there's some gray areas between health and wellness, and then actually diagnosing and treating disease, and that's a boundary that we've really got to work on to try to find. The second piece that we've really focused on as a coalition is this idea of accessories, which made sense in the day when all medical devices were sort of isolated and they were all closed loop systems that worked by themselves, and as a manufacturer you could be accountable for all those pieces. Now everything's connected together, so if you connect something to a device, traditionally FDA has said if you connect to a device you're regulated as a device. Well, you can't regulate the whole network, so we're going to have to find some boundaries there. And the third piece is software that's separate from the device but from a mobile application, but it's very critical to its use. So those are the things that we really talked about, and we shared the perspectives of each of the panel members and then sort of how we collaborate. That's really the focus, yes.
And what does it mean for the everyday user and for a patient or for someone who's using a mobile device?
Great question, because I think, if there's one thing I'd like for folks to take away from our little discussion here, if you're going to get into healthcare as a technology company, if you're out here on the floor as a startup and you're contemplating some great innovation you want to bring to that, you've got to look at it. You've got to look at your responsibilities under the law and determine where those boundaries are and how you're going to market your product. And if you're regulated, it might not be that bad. You just really need to kind of come to grips with it and look at it. The challenges that I've just talked about notwithstanding, folks here on the floor have made it through very successfully, and you're looking at MedApps and WellDoc, a number of great innovative companies that have taken the plunge, have gotten their approvals, and they're going.